Welcome back. My name is Matt Reiners, and I'm the co-founder of Eversound, which was recently acquired by Uniguest, a company committed to developing engagement technology to help communities connect and improve the quality of life for older adults. Today, I'm joined by Maggie Elehwany, the Senior Vice President of Public Policy at Argentum. For those of you that don't know, Argentum is the leading national trade association serving companies that own, operate, and support professionally managed senior living communities. Thanks for joining me today, Maggie.
Oh, thank you for inviting me. I'm very excited to be here.
Yeah. And Maggie, one question I always like to start with new guests. Can you share a little bit about your background and how you got into helping senior living?
Sure, happy to. I work at Argentum now. Our headquarters are near the nation's capital. I'm in charge of overseeing our policy both on a state and federal level. But really, I've been in the Washington, D.C. area for 3 decades now. Came out for a year or two to work for my senator, and lo and behold, got sucked in by all of that. And worked for 3 different senators in my Capitol Hill experience. Worked for the American Medical Association and also the National Rural Health Association, both really important causes, but what really pulled me towards senior living and working with Argentum, like so much that touches on family members or healthcare in general, is just really the personal connection. Meaning that my mom suffered late in life from dementia, and it was when I grew up in Oregon. She was across the country. I was in Washington, D.C. Had some other family members back there too, but searched high and low to find the right community and really found just the most amazing assisted living community for my mom. My mother-in-law lost her husband. Also, she's was on the Eastern Shore in Maryland. Had a big old house where she shouldn't be alone in. And we convinced her to move near us in a beautiful independent living community where she was instantly surrounded by a family, so to speak. Social activities, friends, an environment that was incredibly healthy for her. But finally, the thing that probably touched me the most was my oldest sister, who's really not that much older than myself, had an early onset of dementia after she lost her husband. It was during the COVID period, didn't realize how much social isolation she was in. Again, she was across the country in Oregon, and she had family, but she also suffered from high blood pressure and COPD, and it really helped exacerbate her dementia, and was able to uproot her, so to speak, and move her into a wonderful community, really just down the street from where I am now. So I am so comforted that there are wonderful communities like this, wonderful people so dedicated to help families in really some of their greatest times of need. So it's personal for me, I guess, is the shorter answer to that.
Yeah, absolutely. And I think a lot of people are introduced to this industry because they have that personal story, right? And it's great to hear, despite some of the challenges you've experienced, this is something that you're passionate about and something that is near and dear to your heart. And, really kind of continuing to bring knowledge, bring awareness to this and continue to help some of those people in those communities that are doing this, whether they're the staff there, the residents there. And working for 3 senators and being the DC area for 3 decades now, I imagine you're pretty in tune with all the different stuff that's happening around there. And I'm wondering if you can just kind of give us the overview of the current state and federal policies that are significantly impacting senior living communities today.
Well, if you hear that Washington, D.C. is dysfunctional and it's chaotic, that's actually true. I've been again in this town for a long time, worked for a lot of moderates while I was in Washington, D.C. And unfortunately, The partisanship has grown. Probably the extremes on both sides of the aisle have grown, and really the cost and expense of campaigns is to such a point where so many people have to, instantly go home once they finished a day of session, and campaign and raise money. Whereas, back in the day, it used to be a lot more collegial. People would, fight on the Senate floor or the House floor, and then they would go and have a drink or afterwards, or see each other on their kids' soccer field. We need more of that. How does that play into what's going on for our policy issues? It does impact it. And what I mean by that is, as you know, of course, and your listeners know, is assisted living is regulated very strongly on a state level across all 50 states. We're licensed there. But more and more what we're finding is that the federal government is wanting more and more of an understanding of assisted living communities. There is a big education gap that is needed when we talk to policymakers of all types, not just necessarily on the federal level, but on a state and local level as well. What we're finding is that they really, once they understand what we do, how satisfied our residents are, the families that we serve are, once we really can get our story out, we find that they understand us and they want to be supportive of us. My job as kind of the head lobbyist for our communities across the country is to really help promote what they do on a state level and also on a federal level, so we can take advantage of winning over those policymakers, making sure that they understand really just how dramatically our population is aging and how we're going to need assisted living communities, independent living communities. We are going to need these housing facilities for seniors as they age, and we're going to need caregivers as they age. And we really find that those kind of are big policy areas that are driving it. We've got very positive stories to tell, but then unfortunately, what we're finding at a federal level is we seemingly get lumped in with negative stories, perhaps of other industries. And it just seems overall that there's, more of a, not necessarily a microscope, but at least some kind of binoculars looking a little more closely at us. And I think it's not necessarily a bad thing. I think we as supporters of the wonderful things that our communities do, it's incumbent upon us to tell our story and get our narrative out. And that's a big campaign that Argentum is leading on that.
Yeah, it makes a lot of sense, right? I think when those news stories comes out, definitely puts everything underneath a microscope and just gets more attention there. And I imagine as more and more people are reading that, there's more of those push from what you see from the government to try and impact that and let their voice be heard. And I think definitely from a high level, right, looking at the policy and what that could potentially be and how it kind of varies. But like, how do you see these policies really affecting the daily operations and quality of care in the senior living communities today?
Well, the great information is if we can get our stories out, we do have the data. We do have both and anecdotal stories that really are compelling to policymakers. What I mean by that is the biggest story you have to tell is that we provide a choice for seniors. We provide dignity of care, and we do it in actually a more affordable way than if there were federal intervention, meaning that we save both Medicaid and Medicare dollars. If we didn't exist, we have data that shows that there would be higher expenditures in both of those federal entitlement programs. That's powerful information. We also have the voice of our residents, and our caregivers who can speak to the high satisfaction and the sense of community. I think there's so much of what we've had to do was just better explain who we are, and really why we were created in the first place. There's an incredibly important need for skilled nursing communities, but of course, the model of assisted living was created to give seniors a choice, so they wouldn't be forced into a skilled nursing facility, so they could choose the way and the right housing options for them to age in the way that they wanted. And it's this wonderful communal care model that has so many benefits, not only the fiscal benefits that I talked about of saving Medicare and Medicaid, but just the social benefits. Last year, the Surgeon General came out with a fairly significant report outlining the harms of social isolation, of the impact that it has, not just for seniors, but for kids who may have been isolated during COVID, for adults, just the incredibly negative health effects that it has. And what we're happy to report is that we can help with that. Time and time again, and I'm sure you've talked to many people in your community, in communities, who say, boy, I wish I didn't wait so long. I wish I came here earlier, because they do find a wonderful, wonderful sense of community that really is fulfilling for so many seniors. And that's where we should all strive to be. The push of policymakers and the push of anybody in public is to let people age where they want to age. Nobody wants to be forced into a situation that they don't want to be in. But let's offer those seniors these wonderful choices. Part of what we're doing in a fight for policy, both on a federal and a state level, is helping seniors to be able to access our communities, helping meet the needs of maybe folks who aren't able to afford these communities, but they don't quite qualify for Medicaid either. We're going to have the data is all showing that as all these baby boomers are retiring, so many of them just aren't saving enough for their retirement needs, let alone their long-term needs. And we know that everyone who reaches the age of 65 or older, 2/3 of those folks who meet that age are going to need some type of long-term care. That's what we try to point out to policymakers, is that we need, as a nation, to be preparing for this incredible shift. For the first time in the year 2030, it's not that far away, we're going to have more seniors than we will children in our nation. Never happened before in our country's history. We've always been a very young nation. And the demographics of that population is those who are 85 and older that are really aging in the most rapid fashion. Those are the ones who are going to need the most care. Sometimes when you reach those ages, you really are going to need the most care you do your entire life, except, maybe perhaps when you were an infant. But we've got to be able to have and recruit the appropriate and caring workforce, special workforce needed to help our senior population. And we've got to make sure we have enough communities and capacity. So we've got to help folks who are trying to create these senses of community to do more. We think there's great things that can be done with tax incentive, opportunity zones, a lot of things to really to create access points for seniors. And we think there's a lot of policy that can be done on a federal and some on a state level that can help seniors better save for their long-term care needs. Long-term care insurance is great if you can afford it, and if you don't use up all of its benefits in your lifetime, but it's out of reach for a lot of people. We need to figure out ways to rework that. We need to maybe not necessarily reinvent the wheel, but look at the wheels that we have now and perhaps give them flexibility. There's a lot of incentives now for people to save for various things, whether it's your health savings plan, flexible savings plan, 529 plan, saving for your kids' education, all sorts of different incentives, which are fantastic. What if we made some of these more flexible? Like, what if I was able to use my FSA or HSA to help pay for my sister's care?
Mm.
And what if I was, saved for my kids' college, but we didn't use our 529 account? Can't I use that? Couldn't I use it for my own long-term care needs? I think there's creative things that policymakers are really interested in looking at right now. They understand this looming, they call it the silver tsunami. Some people don't like to call it that. But we've got to remember that these policymakers are going to be so consumed with some of those really big ticket items, like Social Security Trust Fund, like the Medicare Trust Fund. How are they going to fund those things? They're maybe not thinking of, well, on top of that, how are we going to provide housing for these seniors? How are we going to provide care workers for these seniors? That's where we really want them to think about. There are thoughtful policymakers out there. I had a senator on the finance committee say, we get it. I get it. He said, when Social Security and Medicare were established in 1965, we never considered it, Congress never considered it to be a multi-generational thing. And he said, what
Mm.
I mean by that is people usually didn't leave long past the age of 65 back in those days. So never did they anticipate that perhaps you'd have a mother who's 85 and then a 65-year-old child who are actually on those two entitlement programs at the same time. He said this system clearly can't sustain that. Obviously, when at times, especially during COVID and other times where we don't have as many workers paying into the system. So this nation has big issues to tackle in the future. And of course, half of what we are advocating for and being as proactive as possible is to help policies, to help our members thrive and survive, and to create more of these communities and to help more seniors enter into them. And really the other big ticket item that we're advancing are ways that we can develop and improve the workforce that we need. And that is going to be, it's a huge challenge today. It was a challenge before COVID. COVID exacerbated the problem. And then if you look at the projections of how this population is aging, and you look at the shortfalls in not just senior living communities, but really across the board in long-term care, it is incredibly daunting, and we need to get a grip on that now. So we're working on some ideas and have some specific policies on that as well.
Yeah, absolutely. I think there's a lot of opportunity there. And I think you kind of hit some of the things right on the head too. I think I just saw an article come out today, like 20% of people over the age of 55 have like nothing in retirement. And, I think what we'll continue to see as some of these policymakers, they'll probably have older loved ones that are going to be struggling with some of this stuff, or have friends or have loved ones that they're going to see. And, hopefully that will continue to do it. And I think there's creative ways, like you said, like that idea of the 529 to go towards long-term care, or some of the HSA or FSA. There's definitely some ways to, use some money that might not be, that we're getting creative with already, right? Like I know with 529s can now be converted to IRAs, and then there's probably other ways to use that too. And I think a lot of these ideas are great, and like kind of the vision to make it happen. But I'm wondering, like, what are some of the major challenges Argentum faces in advocating for these better senior living policies?
It's just a flat out education problem. I think you hit it on the head, Matt, when you said a lot of these policymakers are older themselves, and then they become familiar with our communities once they have a loved one or have a need for them. It's when we can make that personal connection, sort of like my aha moment when I had my mom went into a community. That's what we need to do with policymakers, really across the board. Our model should be and is by some, but should be so embraced by all, because not only do we have great health benefits, there was a NIC study that came out recently that life expectancies are, and life does expand if you're, and compared it to living in our communities as compared to not living in our communities. We've been able to quantify the social aspect, and getting rid of social isolation. We are doing what if you look at Medicare spending, Matt, and we care for Medicare seniors each and every day, but don't get a dime from it, right? The biggest part of Medicare spending, in fact, it's 99% of Medicare spending, is controlling chronic disease. And there's a whole lot of different chronic diseases, and it's spread across the board on these. But the huge, almost all of Medicare expenditures are just trying to control and treat those chronic diseases. What do we do in our communities? We treat chronic disease. We ensure that medications are taken. We ensure that there's access to healthcare. We can provide transportation to healthcare. We ensure that we focus on those key social determinants of health, safe living, don't have rugs that my mom loved to layer her rugs for some reason. And tripping hazards, with dementia patients, making sure they live in a safe, protected area. But again, we're doing these things and not really getting credit for them. Our goal really is to start this campaign. We call it the I Love Assisted Living campaign, this I Heart Assisted Living campaign. And it's something very, very simple, just like that. It's showing that there are friends, family members, residents who appreciate their caregivers and appreciate the communities that they live in. It's a simple campaign, as I said. It's sort of like that Got Milk campaign, but if we can get that image, that message, and spread it to all, it's going to have an impact on policymakers. You hinted to it before, when you talked about, we can get that microscope at it if there's a negative, Washington Post article. If there's a story, perhaps on a skilled nursing facility that's negative, we can get clumped into those things because again, people, if they haven't experienced us and had that aha moment, we just get lumped in with different entities. And it's really, and then instead of playing offense, where we're advancing this information and we're telling our story, we have to use up too much of our energy and resources playing defense and say, we're not like that. Good example of what's going on right now is there is a close eye and a close investigation in the states and also at a federal level looking at private capital in various entities in healthcare. And there's a lot of states trying to pass laws, preclusions, at minimum, you have to list, every private investor. They think they're going after some of the bad actors, and they like to, private equity is seemingly easy for some policymakers to build up as a bad actor and some REITs. And in a recent proposal by Senator Markey of the state of Massachusetts, they're lumping assisted living communities in their large swath of healthcare providers. Incredibly frustrating because but for that private investment, we wouldn't have these communities. We wouldn't have the communities that we're going to need for a rapidly aging population that we just outlined this great need for. So we really, again, find it incredibly imperative that we talk about who we are and what we're doing. We're actually, the formal definition of who we are is at a federal level is in the U.S. Housing Act, and where assisted living is defined as senior housing. We need to make sure that they understand the important things of how capital it really is needed to even create these communities, and how absolutely fundamentally different we are from some of the negative stories, where there are perhaps some bad actors who came in, especially to the state of Massachusetts, bought out some hospital and some physician systems, and then got highly leveraged, and then closed the facilities down and eliminated access points of care. Obviously, that's a concern for state legislatures, for federal legislatures. Nobody wants their constituents not be able to access health care. But the interesting thing, and I think that policymakers don't understand, and it's an imperative on us to educate them, is that private equity, REITs, private capital in general, creates access points in senior living. It opens up these communities. And I say that because 50% of residents' additions to senior communities are by word of mouth. There is all the incentive in the world for anybody who invests in our beautiful communities to make sure that our beautiful communities stay beautiful communities. It's similar, and obviously historically we were built out of the hospitality and hotel industry. Private investors in Marriott and Hyatt, and they're divested now, have every incentive to make sure that their hotels meet a certain quality and brand, to make sure that they get returning customers. It's really a similar analogy to the importance of making sure that our communities have access to the capital they need so that they can expand, so they can get the technology that they need, so that they can meet the needs of not only this generation of seniors, but they can build the communities for the baby boomers as they're going to need our communities. So I guess that was a long answer to the question, but what we find is that because we need to do more education, we find ourselves, unfortunately, sometimes getting lumped in with other entities. And that's why, again, we think it's important that we unite as friends of assisted living in a campaign that will just better educate policymakers, not just on again, your congressional delegation on a federal level, but really a lot of this private equity stuff is going on in states, and we think it's going to be even likely more significant in the next Congress.
So, Maggie, I know, we've covered a lot here, but I'm wondering if you could share a few recent successes Argentum has had in shaping policy that benefits senior living communities.
Oh, I appreciate you asking that. We're very proud. One of the issues, and I touched on it before, that we hear from our members is just trying to overcome the workforce shortage crisis. What we have been able to do is, and again, it's a partisan Congress, but what we were able to do is advance legislation that's not going to reinvent the wheel. The federal government is actually the biggest trainer of workforces in the country. A lot of people don't know that, but there's no paths that really train people for the aging population that we have. So what we were able to do is get language in one of the end appropriation bills at the end of last year that really it puts in language that'll redirect programs in the Department of Labor and in HHS to really start developing these paths for senior living. These are things like Job Corps, where they with state job training boards. So we hope to soon have programs across the country that'll really start training kids, training individuals who are interested in our industry. So many times, and we've worked with a lot of these kids on one-offs in a Job Corps center in the state of Maryland. And it's like when they learn about this, it's like, I didn't even know those existed. It sounds like a great opportunity. So we think it's going to go far in spreading the word. The other success we had is we were able to get bipartisan introduction of really one of the most significant pieces impacting assisted living to date in Congress, and it's called the Senior Act. And what it does is it's a significant investment in the workforce shortage problem, and it also is a significant grant program that states can apply for that will help lower income seniors receive funding so that they can access assisted living communities. We think it's going to help a lot more seniors be able to access our communities in the future if we can get it passed. It's modeled after a state of Maryland program that does it, and the state of Maryland believes that, you know, can end up saving money if we can. If we know the senior needs care, if we can get them into an assisted living community instead of forcing them into a skilled nursing facility where they're inevitably going to Medicaid, they determined that they could save a heck of a lot of money. The VA is proposing something similar with veterans, which is exciting that people are finally recognizing the great value of our communities.
I love that. Yeah, I mean, it seems like a push to the right in the right direction for sure, and kind of getting that, you know, social component and all of that sort of stuff. And it sounds like a lot of this stuff too, right, is like building that knowledge, the education piece, and sounds like a lot of it is like grassroots advocacy, right? And I'm wondering how important that is in your overall strategy, and, you know, how does Argentum mobilize individual advocates?
Grassroots advocacy is everything. And I can say that as, again, working on Capitol Hill for over a decade. You know, every member that I worked for would, you know, I would go in and say, okay, these groups, and these all support this position. But the question would always be, well, what is my state? What are people in my state telling me? How is it going to impact my state? So when we've got these big federal issues that are fantastic, the way we really get things moving is to get people motivated in the states. We've established an Argentum Advocates program, which has thousands across the country who have joined, which is a simple kind of, you don't need to be a member of Argentum to join. You can just join our grassroots message just to keep you updated with legislation and things, and kind of walk through how folks can get involved. We also, as I said, have launched that even more simplified campaign, the I Heart Assisted Living campaign. And you can just kind of Google that, Argentum and I Heart or I Love Assisted Living, and it'll take you to a grassroots place. What we want to do is, our members are used to kind of not talking about themselves, not really advocating that much. And it's an education battle for our members too, to let them know that it's important for them to share the great things that they're doing. You know, we're significant employers, we're a significant economic boon. And of course, it's really all about those seniors that we serve. Those messages are so incredibly powerful when we share them with policymakers. We just have to get a lot of our folks over the hump of, oh, I don't want to do that. That sounds hard, or you know, it's intimidating. I understand how that can be. We walk you through things, we help you through, and I can't tell you how incredibly important it is to make those local and federal connections.
Yeah, and from all I know about government, which granted, compared to you, is probably like a splinter, but like where the real change can happen is in those more of those local governments, and really having some of those grassroots advocacy or advocates really trying to help promote that and plant those seeds, right? And
That's
I'm wondering,
exactly.
you know, you kind of mentioned it, you know, I think there's some opportunities with the listeners here of what they can do to get out there and help. But, you know, how can listeners get involved in supporting policies that benefit these senior living communities?
Well, and we do have ways, again, that we can send you information or more detail about it. Probably the best start is just going to that I Love Assisted Living campaign to get some information, to share it. We've created it so it can be obviously utilized on a very local level. We're going to have some state specific, you know, images to make signs, buttons, t-shirts, whatever we make, whatever would work in your community. We're here to help. It's just so critically important as policymakers unfortunately lump us in with either bad actors, the few bad actors that may be out there, or industries that really don't make sense for us to be lumped into. We don't want the negative policies from that. If we can educate people, tell them our story, it's going to do absolute wonders. We really are going to be seen by policymakers as the great value, and they'll see the great need for keeping our industry vibrant as our population ages.
Yeah, makes sense. And I can definitely put some links to those websites in the description notes and stuff too. So that's awesome. I look forward to wearing a button or a shirt myself. And then my final question here for you, Maggie, looking ahead, I know you've got that one bipartisan bill that seems to be kind of making its way through, which is awesome. But are there any other major policy goals Argentum is focusing on in the next few years?
I think we really want to make a huge significance in meeting the workforce needs. We want to make a huge difference in helping our communities thrive by helping more people access them, helping people stay in our communities longer. So much of this is going to be done at a state level, and what we are doing is empowering our state associations across the country to really have the tools to fight that. We want to be as proactive as we can, knowing that at the same time, we're going to have to be ready to play defense as we get, some of these private equity issues popping up in states across the country, and again, getting lumped in. So our goal is to help our members thrive so they can help seniors to thrive. So keep as limited federal intervention absolutely as possible, to keep regulation at bay, to allow them to continue to do the great things that they do, but to also help give them the resources, such as a pool of employees that they can pull from, that they're going to need to meet these big challenges. We know we can do it because, again, it really is about getting people to our communities, getting them to understand what they do. And that's when really we have that aha light bulb moment. So it's going to take all of us working together, but we think we really have a bright future ahead of us.
I love that. Well, Maggie, thank you so much for your time today. I learned so much. I know our listeners will get so much out of this, and hopefully our paths will cross at Argentum.
See you soon, I hope. Thank you so much for this opportunity.
If you'd like to know when we post the next episode, make sure to subscribe wherever you're listening to this podcast. If you're interested in how Eversound can help improve the quality of life in your community, find out more at eversoundhq.com.